Hello, everyone. Welcome to Pattern Differentiation according to Zang-Fu organs. Today, we will discuss the lung and large intestine patterns. The lung, located in the upper jaw, connects with the windpipe or trachea and throat and opens into the nose orifice. It dominates dispersing, descending, depurating, and is related externally to the skin and manifests on the body hair. Its channel originates from the middle jaw and runs down to connect with the large intestine. The lung and large intestine are internally, externally connected. The main function of the lung is to govern qi and respiration. It inhales clear air and stores it in the chest to help produce zongqi or gathering qi, which assists the heart to push blood to the extremities. The lung also governs the regulating of water passages. This function ensures dispersal of qi and fluids to warm and moisten the skin and body hair and to regulate water passages. The function of the large intestine is to govern transmission and discharge of waste material. The pathological changes in the lung are mainly reflected in the functional weakness of the lung system, such as the hypofunction of respiration, disturbances in regulating the water passages, and lack of distribution of wei qi. So the lung governs qi and respiration, dominates dispersing and descending. If it is hypofunctional, this will result in qi shortage and a voice that is feeble. If the lung fails to govern dispersing and descending, this will lead to cough, asthma, shortness of breath, and chest pain. If the lung is unable or fails to disperse fluids, there will be fluid retention, edema. Insecurity of defensive qi or wei qi will lead to spontaneous sweating, aversion to wind, the tendency to catch cold. Failure of the lung to nourish the skin and body hair will result in dry hair and lusterless skin. Nasal functional weakness will lead to stuffy nose and runny nose and sneezing. If the throat is affected, there will be itchy throat, sore throat, hoarseness, loss of voice. And finally, if the large intestine is unable to transmit and discharge waste material, there will be constipation or diarrhea. The lung patterns can be classified into two types, deficiency and excess. Deficiency is caused by deficiency of qi or deficiency of yin, which occurs in chronic diseases or chronic cough or in Zang-Fu impairments, while excess results from invasion of wind cold, dryness, heat, or retention of fluid in the lung. Etiology and pathogenesis of lung patterns. So for invasion by exterior pathogens, we have wind cold, wind heat, dryness, cold, and wind cold or wind heat can turn into heat. A depressed and stagnated pathogen will turn into heat as well, so leading to phlegm heat obstructing the lung. Or these pathogens can scorch body fluids to form phlegm. Now, long-standing phlegm turns into heat, therefore leading to phlegm heat obstructing the lung. Cold, damp, coupled with spleen-qi deficiency will lead to phlegm dump obstructing the lung. If one has chronic cough, it can damage the lung. Combined with spleen-qi deficiency will lead to lung-qi deficiency, which can consume the qi. If one has TB, tuberculosis, one can have lung-yin deficiency.